We will be reviewing the assessment of the reproductive system performed by the RN. Assessment of the male and the female reproductive systems should be part of every complete physical assessment. Remember to be sensitive and aware of differences in sexual orientation and/or practices. The objectives for this lesson are: review the anatomy and physiology of the reproductive system, integrate knowledge of menstruation and menopause into the care of female clients, integrate knowledge of the changes that occur with aging in the reproductive system into the care of clients, identify the connections between the client's history and the reproductive system, including nutrition, family history and genetic risk, and genital reproductive history. Review the methods of performing a physical assessment on the reproductive system. And you will also review and analyze the diagnostic assessments of the reproductive system. Here pictured is a diagram of the female anatomy. You will need to refamiliarize yourself with the female reproductive anatomy. Remember, the external genitalia include the vulva, mons pubis, labia majora, labia minora, clitoris, and the perineum. The internal genitalia include the vagina, the uterus, which is consisting of the fundus and the cervix, fallopian tubes, and the ovaries. The vaginal pH is 3.5 to 5. Continuing with the female reproductive anatomy, the breasts are a pair of mammary glands which is an accessory of the reproductive system. Here is a diagram of the female breasts, and you will need to refamiliarize yourself with the anatomy. Breasts are composed of a network of glandular and ductal tissue, fibrous tissue, and fat. They have an abundant blood supply and lymph flow that drains from an extensive network towards the axilla. Part of the female reproductive assessment includes the assessment of the woman's menses cycle. Menstruation is the process of the uterus shedding endometrial lining. This is referred to as menses. A female's first menses refers to the start of menarche. Generally, the cycle lasts 28 days. During that 28-day cycle, a woman should ovulate 10 to 18 days. It's generally midway through the cycle, right after the follicular phase. This ovulation is the process of the ovule or egg releasing from the ovary. The assessment will include menstrual irregularities, unexplained abdominal or vaginal pain, vaginal discharge, itching, sores, infections, rape, trauma, or pelvic injury, or any noted physical changes in the vagina, the cervix, or the uterus. As a woman ages, the menses will become infrequent and eventually cease, leading to menopause, generally between the ages of 40 to 50. Date of menopause cannot be determined until 1 year of no menses. This is known as the change of life. A woman experiences the decreased production of estrogen and progesterone. The reduced estrogen affects bone density, vaginal mucosa becomes thin and dry. Muscular support of the pelvis becomes more relaxed, and they may experience hot flashes, which can be caused by an increase in the FSH and LH levels. There will be an increase in testosterone levels too. The effects of the adrenal gland are either stress-related or physically related. This effect is adrenal fatigue that is caused by a decrease in estrogen, leading to an uncontrolled level of cortisol. Some symptoms of menopause could be irregular menses, hot flashes, insomnia, emotional disruptions, vaginal or urinary difficulties, decreased sexual desire, osteoporosis, weight gain, forgetfulness, and joint or muscle aches. Women have the opportunity for hormone replacement therapy, such as estrogen and or progesterone replacement, but includes a risk for side effects such as breast tenderness, return of menses, cramping, bloating, and or cancer. Here is a diagram of the male reproductive anatomy. You will need to refamiliarize yourself with the male reproductive anatomy. Remember, the external anatomy includes the penis and the scrotum. The internal genitalia includes testes, prostate gland, epididymis, and vas deferens. The pH of semen is about 7.5. Testosterone production is fairly constant in adult males. Only a slight reduction should occur in older adult males until they are in their 80s. The inguinal area is common site for hernias. During puberty, hormonal changes occur. There's an increase in testosterone, and the physical changes that occur are growth of testicles and scrotal sac, growth of pubic hair, body growth, growth of penis, change in voice, facial and underarm hair, and the possibility for acne. As the male ages, the reproductive system changes occur primarily in the testes. Testicular tissue mass decreases and the level of the male sex hormone testosterone stay the same or decreases very slightly. There is also a possibility of the prostate gland enlarging. This is known as benign prostatic hypertrophy, or BPH. The male may also experience erectile dysfunction, which has been noted to be caused by physical or psychological factors. Generally, erectile function is a slowing down process versus complete lack of function. Illustrated here is the differences between women and men in the aging and the reproductive system. As women age, they may experience graying and thinning of pubic hair, vaginal wall changes, uterine changes, ovarian changes, pelvic changes, and breast changes. As men age, they may experience graying and thinning of pubic hair, prostate enlargement, and erectile dysfunction. End of part 1 of the assessment of the reproductive system.